Welcome, everyone. I'm Brittany with Raising Special Kids, and I'm super excited to share this speaker series we have recorded with Leah Gibbs from the Office of Individual and Family Affairs. She's the administrator there, and she is going to be giving us some updates on the Division of Developmental Disabilities and some important information that families need to know. So welcome, Leah. We're so glad that you're here today.
Thank you.
So with the pandemic and the public health emergency winding down, Leah, we know there are some changes on the horizon, and we wanted to get together with you so that you could share this information and let families know what's important for them to be aware of. So I know I've given you some questions ahead of time. We have our list, so let's get to it. Okay. So families have shared recently that they're hearing from their child support coordinator that they need to start having in-person meetings. I know the last few years, as you're aware of, we've had virtual meetings, which has been convenient, but now we know that we are having to switch to in-person. Can you elaborate on that and let us know why that's important?
Sure, you are correct. Access did obtain approval from the Centers for Medicare and Medicaid Services to allow support coordinators to conduct planning meetings virtually during the COVID-19 public health emergency. During that time, some teams chose to have planning meetings in person, while others chose to meet virtually. The division has been communicating that beginning April 1st of 2022, members and families would have the choice to return to in-person meetings. However, with the ending of the public health emergency, DDD did make a determination to return to in-person meetings effective April 1st of 2023.
Okay. So in thinking about that, how does that personal connection, having your child support coordinator come to the home, how is that a benefit for families? How will that affect their person-centered plan when they're trying to figure out what services their child needs?
Thanks for asking that. Planning meetings are the core of the work DDD does in helping its members live self-directed, healthy, and meaningful lives. The personal connection developed between a support coordinator and a member is key to helping each member achieve their goals and live the life that they want to live. In-person planning meetings are necessary to ensure support coordinators can truly assess each member's health and well-being in their living environment. This includes seeing their entire living space to ensure that they have what they need and to meet the essential needs that each member needs, as well as to be sure that that member is free from abuse, neglect, or exploitation. And those kinds of assessments are really difficult to do in a virtual medium.
That makes sense, and for some families, including my own, we got a new support coordinator over the course of the pandemic. So recently we had our in-person meeting with my daughter's coordinator, and it was really great for her to actually be able to meet her, assess her needs, and really get the whole picture of what services would benefit her. So it definitely was a good thing.
Good.
Okay. So let's talk about the electronic visit verification system, EVV. Kind of a mouthful to say. So admittedly, I'm sure you're aware that many families and providers have had a little confusion or needed time to adjust to this system that we have to use. Can you briefly share, how EVV works and why we must have this in place for all home and community-based services?
Absolutely. Electronic visit verification is a federal requirement that passed in December of 2016 as part of the 21st Century Cures Act and is a mandatory program. Electronic visit verification ensures, tracks, and monitors timely service delivery and access to care for members. Think of it like a time card for workers where they clock in and out for their job. The goal of electronic visit verification is to ensure DDD members are getting the services they need in the way the planning team identified. Electronic visit verification applies to all providers of impacted services, including family members who are direct care workers. All people who receive Medicaid cover services must participate. The DDD services that are impacted include attendant care, homemaker or housekeeping services, habilitation hourly, home health services, including nursing, licensed health aid, and home health aid, and the service respite.
Okay, thank you. So you definitely captured a lot of my questions there. A lot of our parents who are currently caregivers for their child have a question regarding, schedules. So with EVV, do the schedules have to be predetermined ahead of time?
Yes, schedules are predetermined ahead of time, including family members who are paid providers. Qualified vendors will help members set up their weekly schedule in their electronic visit verification system. A schedule helps DDD know if members are getting the services they discussed with their planning team. Some visits may start and end at times that are different than the weekly schedule, and that's okay. Just be sure to record the reason for this for the employer. Members with live-in caregivers do have the flexibility to develop a schedule or not. Access has published an Access Frequently Asked Questions document that has more details about scheduling for these services, and that document is located on the Access webpage. Members and families should contact their qualified vendor agency if they have questions about the agency's electronic visit verification system, and that would include the agency's process if a provider accidentally forgets to clock in or clock out. Members, guardians, and direct support professionals should all be using electronic visit verification now. Generally, the electronic visit verification device captures the location when a provider starts and ends the visit. The location is not required to be in the member's home and can occur anywhere in the community. However, there are exceptions to the use of the electronic visit verification device, and Access offers some flexibilities, such as the use of paper timesheets with a fixed visit verification or fob device for those members who meet certain criteria, including if there is limited or no connectivity available where the member lives, or if the device would cause adverse health effects or adverse health symptoms, if there are moral or religious grounds against using an electronic device, or if there are live-in caregivers providing the service, and when witness or domestic violence protection programs are in place. When a provider is using a fob or fixed verification device, services must start and stop in the member's home, and the provider needs to list that code generated by the device on their timesheet. The member can still go into the community when receiving services during the visit, but the service must stop in the home under the circumstance that a paper timesheet is being used.
Okay. So many of our families, I think you probably would agree, most families are doing EVV and not doing the paper timesheet. So I just want to ask you this again, because we get this question a lot. So if the schedule's set up to where, say the provider is going to be out in the community working on habilitation goals, so they could clock out if they're somewhere other than the home. Is that right?
That is correct.
Okay, wonderful. So, and then as far as, clocking in or clocking out and forgetting, I know a lot of parents were, especially parent providers, were concerned, like, what if I forget, I get consumed in taking care of my child? Is there a penalty, or is it more so, talk with the agency that you work for and they'll help you fix that within the system? Is that what the parent needs to do?
That is correct. The parent really needs to reach out to the agency they work for, explain to them what has occurred, and the agency will support them in making the change. There is no doubt eventually everyone would like everyone to remember and be comfortable using it, but it's all an adjustment right now.
Definitely. Okay, thank you, Leah. So, raising special kids and of course, all the families we serve, we have been so grateful for that parent as paid caregivers flexibility for their minor children that we've been able to participate in that began, when the COVID-19 pandemic started. So as the public health emergency is ending, how does this affect the parent-provider flexibility?
So right now, parents as paid caregivers for minor children is the flexibility that, as you said, began at the start of the COVID-19 public health emergency. And the reason it began was to reduce the number of people that members had to be in contact with from coming inside and outside of their home. The flexibility was set to expire at the end of the COVID-19 emergency. However, the Department of Health and Human Services announced that the federal COVID-19 emergency did end on May the 11th of 2023. But despite the emergency ending, Access has announced that the Parents as Paid Caregiver for Minor Children flexibility will continue just the way it is until November 11th of 2023. And that is a new change in direction for the program, and it will stay the same. At this time, Access is not implementing any changes in the flexibility and do not have additional information about changes in the number of hours a parent can provide the service. And right now, it will continue the way it is, that the parents can provide the service based on the number of hours that are assessed and meet the needs of the child. Parents as paid caregivers for their minor children flexibility was included in the Access American Rescue Plan Act, ARPA, spending plan. This plan was approved by the Centers for Medicare and Medicaid Services, and under the ARPA funding, the flexibility is currently set to expire September 30th of 2024. I feel like I want to say it just one more time. So what's happened is that Access has said that they're not changing the flexibility in any way right now through November 11th of 2023. And as soon as DDD has any additional information about what changes may go into effect after that November 11th date, we will be sure to reach out and let families and members know. The division maintains a webpage. We call it DDD Actions Related to COVID-19, and you will find a link to that webpage on the DDD homepage. As you scroll down on that Actions Related to COVID-19 page, there is a heading for an area called Service Delivery Changes, and that includes a table of all the flexibilities that have been implemented since the beginning of the public health emergency in our DDD program. The table identifies the change that was implemented from our normal practices, the date the flexibility started, and the date it ended, it will end, or if the flexibility is going to continue moving forward. So specifically to the parents as paid caregivers of minor children, right now there are no changes to it, and there are no changes planned to occur until at least after that November 11th date.
Thank you for recapping that. Definitely was going to ask you a few clarifying questions, but you addressed those. So thank you, Leah. So to ease parents' minds, while the public health emergency is ending and through November, we know that no changes thus far are happening, the program will continue through September, end of September of 2024. Is that my understanding?
That is our understanding as well, yes.
Okay, thank you. Okay, last question I have for you today. So parents have been asking us recently about the changes in attendant care with supervision, and there was a policy update. Can you kind of clarify that and let us families know what that means?
I am happy to. So when a support coordinator is completing an assessment to determine if attendant care supervision is a service that a member needs, they're following our policy. And that policy is called the DDD Medical Policy 1240A, and it's titled Attendant Care Supervision Requirements Age 17 and Under. In the policy, it requires that a parent, guardian, or adult not be in the home if the support coordinator is going to consider assessing for this service. But during the public health emergency, DDD temporarily waived the requirement and will allow the service to be assessed, even if the parent, guardian, or other adult is in the home. And that particular waiver to that requirement is going to continue just the way it is through that November 11th of 2023 date.
Okay, great. Thank you. I know a lot of families have had concerns about that. And so given all of these, questions that we've had for you today, we know that the division is really good about updating families. So as we approach that November date, I'm assuming if there's any big changes, things families need to be aware of, you all will definitely inform us and inform us families on what we need to know.
Absolutely, absolutely. Keep an eye on that webpage, and I'll be happy to make sure Raising Special Kids is aware.
Thank you so much.
Mhm.
Well, thank you again, Leah, for joining us today for this speaker series recording and giving us, some important updates that we need to know about. We're so grateful for our community partners, especially at the Division of Developmental Disabilities, and we always appreciate your support and helping us, serve the families that participate in these programs. So thank you. We do appreciate your tireless efforts on behalf of individuals with disabilities in our state and being available to do this session with us today. So thank you.
Thank you for the invitation.
You're welcome. And families, if you have any additional questions, you know where to find us. Please reach out to Raising Special Kids. We are here to support you. And with that, we will see you next time.